Unmute.
The power outages. I am Michelle Sear. I am Senior Associate Dean for Academic Affairs for Biology and Medicine. And on behalf of Brown University and the medical school, I'd like to welcome you and thank you for taking time out of your very busy schedules to participate in this afternoon's promotions workshop for clinical and clinician educator track faculty. In my role as Senior Associate Dean for Academic Affairs, one of the offices I oversee is the Office of Biomed Faculty Administration, which supports more than 2,000 of our faculty in the division. We facilitate the recruitment, the appointment, retention, and promotion of faculty members across 16 clinical departments, as well as the 5 biology departments on the campus. One of the ways in which we support our faculty is through informational workshops like this, which I also provide on a smaller scale for departments on request. The Office of Biomed Faculty Administration typically hosts one large promotions workshop annually for all the Brown Clinical Department faculty. But this year, our second year of Zoom, we've decided to split the workshop into 2 separate workshops, allowing us to focus on the different needs of our 2 groups of medical faculty. This workshop is for the clinical track faculty on the clinician educator and clinical tracks, and we will have an academic medical track faculty workshop on November 10th for faculty on the teaching scholar, research scholar, and parens research tracks. So before we begin, I'd like to recognize the various groups that have supported this program. Certainly, I want to thank the Office of Biomed Faculty Administration, including Michelle Turcott, Abby Botello, Matt Bolton, and Alex Kelleher, who've done yeoman's work to put on this workshop. I'd also like to thank the Office of Continuing Medical Education for their work to help us provide CME. I'd like to thank the Office of Faculty Professional Development for promoting this event. I'm incredibly grateful to our panelists and to our breakout session presenters who've graciously given of their time to share their wisdom and their expertise. And last, but certainly not least, I'd like to thank the Clinical Faculty Advisory Committee for co-sponsoring this workshop. Now I'd like to introduce Dr. Linda Nietzsche, who is Professor of Medicine and recent past chair of CFAC. And Linda is going to speak about CFAC and the work that they do to support our clinical department faculty. So Linda, are you there?
I am here. Can you hear me?
I can.
Okay, hopefully some people can see me too. I see the slides up. But anyway, I'd like to share Dr. Sear's welcome. I'm really happy that we were allowed to do this in a split fashion because I do think, in my mind, the clinical faculty are the backbone of this medical school, and having time to really talk about how we promote you within Brown is really important. So the CFAC is actually a voluntary committee within the medical school. We're actually voluntarily appointed. We're not voted in, but what our purpose is to really support the clinical faculty, both with giving them opportunities for teaching, making them aware of developmental, educational development workshops, also helping you when there's problems for promotion. So if there's nothing else I can add to tonight's presentation, is that we are here for the clinical faculty should they have any confusion or questions or problems with promotion, how to go about it, who to contact. We really, again, our main aim is to promote you and make sure that you get your fulfillment through the medical school in your teaching roles. So you can reach us through the website. You can reach any of us on the brown.edu email, but we are very happy to talk with anyone about what happens tonight and also anything that happens within your time within the university and the clinical teaching that you do. And we appreciate everything that you do. And again, a thank you to Dr. Sear for allowing us to participate and sponsor this for this evening's presentation.
Thanks so much, Linda. And thanks again to CFAC for co-sponsoring this event. I know that CFAC has done so much work to help faculty with the promotions process. And so this is really, really important. So thank you. So before I begin the PowerPoint presentation, I'd like to start with some logistics. The first hour of this workshop is being recorded and will be available later for viewing if anybody wants to do that. As we proceed, please submit any of your questions via the chat function. They will go directly to Alex Kelleher, who will be monitoring them throughout the program and who will be able to ask those questions of our panelists when we move into the panel discussion. We'll start the program with a general overview of the promotions process, and that will be followed by the panel discussion, during which time there will be ample opportunity for you to ask questions of our panelists and for our panelists to answer those questions. I'd like to give special thanks to you, to those of you who provided questions in advance of the program, and I promise that we will make sure to address those as we go along. So at this time, I would like to go into the PowerPoint presentation and let me be sure that my screen is being shared, which I think it has been. Let's see if I can actually do this. Yeah, there. Okay, so the goals of this afternoon's workshop are first to provide some basic information about the faculty tracks, the promotion dossier, process, and timeline. I'm hoping that we will dispel any myths that are out there and any misunderstandings that anybody might have. We will be sharing promotion tips along the way, and we'll certainly be answering your questions throughout the afternoon. So the two tracks that we're going to be discussing today are the clinical track and the clinician educator track. And this slide shows you the way the tracks are titled. So for those of you on the clinical track, your title would be Clinical Professor of Department X, so Clinical Professor of Pediatrics or Medicine or Psych. For the Clinician Educator track, the track is titled Professor of Department X, Clinician Educator. Formerly, it was a parentheses with clinical in the parentheses, and there was a lot of confusion about what that meant. So I'm pleased to say that we were able to change that a few years ago. So this pie chart gives you an idea of the composition of our faculty at Brown University in biomed. And you can see that there are over 2,000 faculty members, and the clinical track faculty take up nearly half of all of our faculty, and the clinician educator track faculty take up over a quarter. So together, your two tracks comprise 75% of the medical school faculty. And so when Linda says that you are the backbone of our faculty, she really means that you're the backbone in terms of the teaching that you provide, and certainly by the numbers, you're more than the backbone. So now we're going to move on to the faculty tracks and the standards and criteria that are associated with the various tracks. So I know that this is a pretty busy slide, and I'm just going to move this if I can a little bit. This is a fairly busy slide, but oops, well, now it's not a busy slide at all because it's not there. Sorry about that. Back to the associate professor slide. Let me see if I can move this. I am definitely technologically challenged, so please forgive me. There, I think I can see it now. Okay. Wait 1 second. Sorry about this. So as I said, this is a busy slide, but I think it is useful. It depicts the 5 tracks that we have in medicine and the criteria associated with those tracks. The notations in the boxes associated with the criteria tell you whether the criterion is required, that's an R, not required, NR, or positively considered, PC. That's not a politically correct, it's a positively considered. And you can see the highlighted columns are for the clinical track and the clinician educator track. And the two tracks, oh, sorry about this, this is very jumpy. The clinical track and the clinician educator track are very similar across a number of the criteria. And the areas where they differ are in the area of scholarly productivity and publications. So this is at the associate professor rank. For the clinical track, that is positively considered. So that means it's not, scholarly productivity publications are not required, whereas for the clinician educator track, they are required. Both tracks require a regional reputation for the associate professor rank. And you can see that certainly teaching, mentoring, and advising is required for both tracks, as are clinical contributions. When we move on to the professor rank, again, you can see the highlighted clinical track and clinician educator track. And here, for both tracks at the professor rank, scholarly productivity and publications are required, and both tracks require a national reputation. So I hope this gives you some sense of the general differences. And this is a slide that will be available to you on our website if you wanted to look at it more closely, to have this information. And I think it's also useful to study it to see how the teaching scholar track differs from the clinical track and clinician educator track. So here are the specific criteria associated with the clinical track. Again, this is at the associate professor rank as well as the professor rank. And the criteria are those that relate to teaching and/or service, clinical work, scholarship, and reputation. Where there's no division between associate and full professor, it indicates that the criteria don't change across those two ranks. So for the two ranks, a high level of skill in teaching, advising, and mentoring is required. For teaching service, it's 100 or more hours of teaching and/or service per year for the clinical track for both ranks, a high level of skill as a practitioner for both ranks. Again, for the associate professor rank, scholarship is positively considered and it is required at the professor rank. A regional reputation is required at the associate professor rank, and a national reputation is required at the full professor rank. The next slide shows you the standards and criteria associated with the clinician educator track. And you can see that the teaching and/or service requirement for the clinician educator is over 200 hours of teaching and/or service. Additionally, what is not indicated on this chart, but is probably important to highlight here, is that clinician educators must be employed by an affiliated entity. So to be on the clinician educator track, you would have to be employed by a hospital, a foundation, a department, a faculty practice plan that's affiliated with Brown University. Again, you can see here that at the associate professor rank, a reputation regionally is required, whereas a national reputation is required at the full professor rank. So we do have a new criterion that is being added to the standards and criteria for faculty appointments and promotion, and this is related to diversity, equity, and inclusion work. So over the past year, I convened a working group to look at how our faculty are recognized and rewarded or not for the work that they do in diversity, equity, and inclusion. That working group made a number of recommendations. And one of those recommendations was to amend the standards and criteria for faculty appointments and promotions to have a requirement that faculty do work in DEI. That recommendation was vetted through the biomed advisory bodies and approved once it went through all of those different advisory groups. And it was approved in the late summer. You should have gotten a letter from me letting you know about this new requirement. The way it is worded in the new standards and criteria is that for all faculty in all tracks at all ranks, they must have demonstrated a commitment to diversity, equity, and inclusion. So these words are added to the standards and criteria, as I say, for all tracks and at all ranks. This new criterion will not go into full effect until July 1st, 2024. And the reason we did that was to give faculty ample opportunity to think about the work that they do in DEI, to add work in DEI if they're not currently doing any, and to have their CVs, their personal statements, their annual reviews reflect that work. If faculty are doing this work, certainly in advance of July 1st, 2024, we are encouraging them to include it in their promotion dossiers, as well as include it as part of their annual reviews, and they will get credit for doing this work at the time of their faculty promotion. We do have metrics that we have amended to include examples of DEI activities, and I recommend that you look at those metrics to get a sense of the kinds of work that would be considered demonstrating this commitment to diversity, equity, and inclusion. So now we're going to talk about the components of the promotion dossier, and let me reassure you that this is not what your promotion dossier will look like. In fact, we have gone completely paperless since the pandemic. So basically your dossier is just a folder on a Google Drive, but this is the way it might feel as you put the components together. So if you look at the components of the promotion dossier, there are some that are required from the candidate and then those that are required of the department. So the components that are required by the candidate are certainly an updated CV, your personal statement, your number of teaching and or service hours for clinician educator and clinical tracks, your teaching evaluations, and the list of your suggested referees. The department is responsible for the chair and division chief letters of support for your promotion, the department promotions committee report, sample letters that were sent out to the referees, referee letters that were submitted to the department, both those that the department chose and those that you choose or were chosen from your list of candidate referees, and then your evaluations. So the curriculum vitae is certainly a big part of your promotion dossier. And these are a number of tips as you're thinking about putting together your CV. First and foremost is to put your CV into the Brown format. And that Brown format is available on our Biomed Faculty Administration website. And I strongly recommend that you look at that. You do not have to feel constrained by that format, in that you are certainly welcome to add additional subheadings and other headings. We just want the components that are in the Brown format template to be used, and then you can add things as you see fit. And certainly anything that you feel is important to include in your CV that might warrant another heading or subheading, please do include it. When you think about your CV and how it will be reviewed, think about putting it into a form that makes the reviewer job easy. So anything you can do to help your referees look at your CV and understand it and see where you're doing your work, and also certainly the promotion committee members making their job easier as well. So a number of things that you might do is, first of all, highlight your name on any publications so that they can get a sense of where you are in the list of authors on a publication, be it the first author, the last author, the senior author, or somewhere in the middle. If you do have grants, be sure to include the granting agency, your role in the grant, and the dollar amount of the grant. The next tip is really, really important, and that is to separate your invited presentations into local, regional, national, and international. And I really want to emphasize this because we're seeing a lot of CVs coming through without that separation, and it helps you to separate into those categories, because there may have been a conference that by my eyes might look like it's a local conference, so it might have been held at Brown, but in fact the guests, the attendees came from an international group. So be sure, because that then would then become an internationally invited presentation. So this is really, really important. Organize your professional organization into activities with listing of your roles. So if you've been involved with the American College of Physicians, and you might have been involved with the Rhode Island chapter, but then maybe you are on the membership committee for the national organization, be sure to list those roles that you've had in that organization over the course of time, because it gives the reviewers a real sense of your progress in the organization. When you do put your CV together, get feedback from colleagues, from your division chief, the promotion committee, and the chair of your department. And then ask a colleague if you can review a CV, particularly of somebody who's been recently promoted, because that can be very helpful to see how they've organized their CV. The actual components of your CV, one of them is going to be your teaching activities. So for your teaching components, be sure to record all of the teaching, advising, and mentoring that you do, and the titles for those activities. List any advisees and mentees that you've had over the years. Certainly list your role in any course or rotation that you might have participated in. Give the dates, numbers of and types of learners that you've taught. Certainly any awards that you've received for your teaching activities, your evaluations, all of your evaluations for classes, lectures, presentations, precepting, any scholarship that has resulted from your teaching, advising, and or mentoring. And I've seen a number of faculty members actually highlight their mentees in the list of authors when they have published with them. Certainly include any curricula that you've developed, and if it's been disseminated and published, it actually counts as scholarship, so be sure to include that as well. In terms of your teaching, mentoring, and advising, keep a file of all of your evaluations. And this is really important because it can sometimes be very difficult to get your evaluations at the last minute when you're trying to put your dossier together. So if you can keep a file of your evaluations, it can be very helpful. Most of the evaluations right now are in electronic format. So for the medical students, the program is OASIS. And for GME programs, it would be either new innovations or eValue. Certainly include also any evaluations that you've gotten from invited presentations, from your advisees, and from your mentees. And don't hesitate to ask program administrators for help. So clerkship director, clerkship administrators, residency coordinators, fellowship coordinators, and anybody who's running CME courses, I'm sure would be more than willing to help you get your evaluations for your dossier. The scholarship and research components of your CV are going to include your original publications. So if you have any peer-reviewed original publications, include those for sure. Any peer-reviewed other publications, also include any chapters, any books, any case reports that would be included in other publications. If you are doing research work, again, include any research grants you have, the agency, the title, your role, the dollar amount, and the years of the award. And also include a list of any research trainees that you have mentored. Now we're going to be talking about the referee letters. So the purpose of referee letters is to provide an objective and unbiased assessment regarding how you meet the Brown criteria for promotion, your reputation, be it regional, national, or international. And they're also asked the likelihood of your promotion at their institution. Referees should be at arm's length, in quotes. And that means that the best referees are ones that have not been your mentees, your mentors, your collaborators. It may be somebody that you worked with on a panel, but it shouldn't be somebody with whom you have published and done extensive work. So it's best, as I say, to get that objective arm's length review. Referees must be at your promotion rank or higher. So if you're going for associate professor, they have to be associate or full. And if you're going for full professor, they have to be full professors. They do not need to know you specifically because they're going to be provided with your dossier for your review, for their review. and will be able to comment on the various questions asked on them based on that review. So once again, be sure that your dossier reflects how you meet the criteria. You're also expected to have a personal statement in your dossier. And the personal statement, there's a lot of, I think, misunderstanding about what should be in a personal statement. This is my opinion based on many years of chairing the Committee on Medical Faculty Appointments and Promotions. But I think that the best personal statements tell the story of your career path. They should be a biographical essay, so we can get a real sense of how you have progressed through your career. Please keep it brief, 2 pages max, and that doesn't mean lowering the font to get everything in there, but 2 pages max is best. This personal statement is a great place to explain what might not be clear from your CV. So if there are things that you feel you need to fill in, gaps you need to fill in, then it's a good place to do that. Help the reader understand who you are, what you do, and what gives your job you joy in your career. And remember your track. So if you're on the clinical track, it's probably best not to say that research gives you joy. It's best to say that you get joy out of clinical work and teaching in that context. Present your goals and aspirations and how you hope to realize them. Again, remember your track. So I hope that your goals and aspirations fall along the lines of your faculty track. And it's like real estate, again, remember your track. So what's the promotion timeline and process? It seems like it takes a long time, but I liken it to baking sourdough bread. So even though the sourdough bread may take 3 or 4 days, the actual time of engagement is very limited. And that's true of the promotion process. So it may take over a year to be promoted, but your participation in that will be relatively brief. A lot of the work is done on the department side. So what are the steps in the promotion process? The first step is that you and your division chief or department chair decide it's the right time. You are notified or informed of the departmental deadlines, and you prepare your promotion documents. At that point, most departments, I think almost all departments, do a preliminary departmental review. And if the department promotion committee or department chair think that you're ready, they will inform you about going forward for the promotion. The next step is that the department solicits the referee letters for approved candidates. So referees from your list and from the department list. The department promotion committee reviews the completed dossiers and forwards the recommendations to the chair. So the department promotion committee, if they approve, will forward that recommendation to the chair for the chair's approval as well. At that point, if the chair approves, the department will submit a completed dossier to CMFA, and then CMFA reviews dossiers and votes on the promotions. So this is not your CMFA. So who is on the committee for medical faculty appointments and promotions? Well, all members of the committee have to be at the full professor rank. So they have to either be in a medical academic track or be campus-based faculty who are tenured at the professor rank. Each member has a 3-year term. It's an 8-member committee. I am an ex officio member of the committee. I don't vote, and I chair the committee. So there are 5 members from clinical departments, 1 from biology, 1 from public health, and 1 from another university department. And this year we have somebody from archaeology, which is terrific. The committee reviews all senior level promotions and appointments in the clinical departments. So every member of the committee reviews every dossier that is forwarded to it. We meet throughout the academic year. When we get together as a committee, as I said, the committee members have all read the dossiers. We discuss the dossiers and then formulate questions for the department chair. The department chair then comes into the meeting and presents candidates and answers any questions that may have developed. So this is the actual approval process depicted here. So it starts with the Department Promotions Committee and chair. Then the dossier is forwarded to CMFA. If CMFA votes to approve the promotion, the chair is allowed to inform the candidate of the CMFA vote, with the caveat that it will then have to go to the dean, the provost, and the president for approval, so that once the president approves the promotion, then Biomed Faculty Administration sends a letter to the candidate and says that the promotion will be approved pending the corporation approval. And then the actual date of the promotion is the July 1st date subsequent to that vote. There are sometimes when there's a backdated promotion, sometimes in the fall, but most promotions are dated July 1st of the subsequent year. So I really want to encourage you to start the process. There's no harm in approaching your division chief or department chair or the promotion committee chair to ask if the time is right for you. So go for it. So at this time, I would like to stop sharing if I can do this. Yep, I can do that. Okay. And invite our panelists to join us. I guess our panelists are all here. Are you all seeing everybody, or is it just me?
See everybody.
Okay, there you go. I'm so confused about what's a webinar and what's a Zoom meeting, not webinar, but here we are. Okay, great. So thank you so much for being with us. I am going to ask our panelists to introduce themselves. And so I will call you out individually, and please introduce yourself and tell us how you participate in the promotion process. So Penny Dennehy.
All right. So I'm the promotion chair for the Department of Pediatrics Promotion Committee. I've been doing it for quite a long time. I can't even remember how long it's been, but it's been quite a while. And I got into this basically because I was interested in mentoring people, and that seemed to be a good opportunity, which my department chair gave me to do so. It's a process that I've really enjoyed because I get to know all of our junior faculty. I get to talk to them. And in particular, the process that Shelley describes is sort of the end game. And we do a lot of pre-promotion consultations really with individual faculty members. My promotion committee actually has a schedule where we try and review everyone on a set schedule so that nobody falls through the cracks. And we've been gradually finding people that have gotten a little bit lost. So hopefully other departments are also doing that, so that if you've been at rank for a while, you've gotten a review and you have some direction. Because I think that's the biggest problem I see is frequently people haven't attended these sorts of workshops. They really don't understand what things they need to do to gain promotion at the rank and track that, or at the in the track they're in at the next higher rank. And it's also helpful to sort of work with people and remind them of little tricks and things. For example, keeping your CV up to date, not waiting until you're up for promotion and then trying to reconstruct what happened in the last 5-6 years of your life, or keeping a folder where you keep all your evaluations that you've gotten, because sometimes they tend to, especially when we switch from eValue to new innovations here at Rhode Island Hospital, we lost all our eval evaluations if they hadn't been downloaded. So I think those are the sorts of things I spend some time talking to people about. And I will stop here and let some of the other panelists talk.
Deb Myers.
Hi, afternoon. Thank you. I'm Deb Myers. I'm in Department of OBGYN. I'm the chair of our promotions committee, and I've been doing it probably 7 years. Like Dr. Dennehy just mentioned, it's a great mentoring opportunity, and you get to kind of help junior faculty, move up in their career path. And there's a lot of preliminary counseling and mentoring that goes on, before you even get to this process. And it's guiding people through their careers. Similarly, we have a annual review of all our faculty to make sure we've captured everybody. We also have an assistant chief who also assists us in the faculty or out in the practices, not just necessarily me overseeing everybody. So there's a lot of people that are doing lots of different things that I may not necessarily know about. So we utilize somebody who's actually, working, with the community physicians on a regular basis, because they'll have other input. So, and similarly, we have a process, with regular meetings where we bring candidates forward. I help people review their CVs and format, spend a fair amount of time doing that as well. So it's been a great experience, and I'm hoping everyone can, gain some answers to their questions tonight. Thanks.
Great, thank you. And Matt Bolton.
Hi, I'm Matthew Bolton. I'm the manager of academic affairs in BMFA. I work very closely with Shelley and the rest of the BMFA team. As far as CMFA goes, I'm the administrative coordinator, for lack of a better term. I put together the calendar every year. I work closely with the department administrators. I'm the first pass at your dossiers. So when a dossier is submitted, I'm the one that makes sure that all the components are in place, all the I's are dotted, T's are crossed, make suggestions for corrections, amendments, things like that before these things go to the committee. And on the back side of the CMFA vote, I'm also responsible for making sure that the relevant officers on campus are made aware of the committee's decisions, and ultimately get your names and your actions in front of the president and the corporation. So that's kind of it in a nutshell. There's a lot more to it, but I don't want to bore you to tears. So
I can attest to the fact that there's a lot more to it that Matt does. So yes, indeed. So I think you've already started to get into this, but I'm just going to ask our panelists if you have any other tip that you'd like to start with for faculty members considering promotion.
A couple of things, I think. If you want to have somebody assess you, it's perfectly permissible, and we encourage it to approach, at least in the Department of Pediatrics, me as the department chair, the department promotion chair, and we will put you on our list. We have regular meetings once a month of our promotions committee, and we put people on the list to be reviewed. The other thing that we do that we've really tried to beef up is feedback. Each person who is reviewed by a promotion committee member. That promotion committee member becomes sort of your promotion mentor, and they are charged with giving you feedback about the promotion process and what the committee's findings were about things that you need to work on, potentially to become promotable, or to get back to you to say, great, you've done what you needed to do, and we're going to launch your promotion process. We also do some meetings with each person who's up for promotion to go through all the things that Shelley listed, the personal statement, all of those things that are required, so that each person gets some individual counseling on how to do that. I think, trying to think, there's one other thing that had popped into my head, and I'm hoping to remember it, that basically, this is a process that people view as being very lengthy and hard to get through. And it is a process. Matt has the unpleasant task of scheduling, and we cannot always get everyone that we want to have promoted in on the schedule for a particular year. There are, the CMFA has only so much bandwidth and so many hours that they can review people. And so we do try and work with people to have them understand that we have to triage those that are the most ready go up first, and those that are needing a few more things may have to wait a little bit. And that's not because we are trying to delay your promotion, it's because of the reality of trying to have it be that those people who are most ready go up first, and those that have a little more work to do are put on the lower down on the list. And it's not a fun job from my point of view of having to tell someone, you know, you're going to have to wait till next year, but that's the reality of it. And Matt may want to speak to that a little more too.
Yeah, so the committee reviews about 100, or we can review up to 100 actions a year, an academic year. The committee meets from September through late May. They meet every 2 weeks with a break, obviously, around the holidays. I do my best to make sure I get everybody on there as best I can. And throughout the year, you know, once I'll create a calendar going into September. Throughout the year, that calendar is fluid. Things get taken off, people get added, things get moved around. So thank you, Penny, for recognizing it is a challenge. It's a logistical challenge to make sure everyone gets on there. And there are also other factors that may contribute, you know, chair availability to be able to present, or any, you know, it's hard to say because some things come out of the blue that you never expect, and you have to push an action or remove an action from the calendar. But we do our best to get everybody reviewed that, you know, comes across my desk, you know. And like I said, we're trying to find ways we have to get even more people reviewed, trying to find creative ways to squeeze as many actions as we can into the year, because we recognize departments are growing, and we don't want, and you know, we want to recognize your efforts and want to get you promoted. It's not, we don't want to stand in anyone's way. It's just like you said, there is so much bandwidth that the committee that we have, and only so many spots throughout the year that we can use to review these actions. So, but thank you, Penny. If I could add, so I want to also I had a couple of tips. One of them, Penny had mentioned regarding your CVs. Yes, please actively update your CVs throughout the year. If there's, you know, any, you know, your teaching activities, your scholarship, your awards, once it happens, go, you know, have it, you know, on your desktop and pull it up, add your award, add your activity. So when your administrator comes around and says, I need your CV for your dossier, you're not scrambling saying, oh, what did I do 3 years ago that I want the committee to know about? They'll just have it right there. Another thing I want to add, in particular regarding CVs and scholarship, is to make sure that when you are listing your scholarship, if you have scholarship that's been submitted, or, you know, papers that are in progress, please do not include them with your peer-reviewed publications. So you can have a separate section for your submitted or drafts in the CV, but please don't include them with the published and peer-reviewed publications. So those are two of my tips. I don't know if you want to move on, or.
No, that's great. Deb.
I was going to kind of maybe take a kind of different tip for everybody, but that I believe in these particular tracks, people are very busy, okay? They're very clinically busy, they're seeing patients, you know, and I think for some physicians, this might be like, oh my God, it's one more thing I need to do, you know, how am I going to fit it all in? And you know, I don't have papers written, and, you know, that kind of thing. I just want to emphasize that this is really a teaching education thing. And that is something that everybody I can see on the Zoom is doing every day. And I think one thing that you might find that in your clinical practice, you know, you have one-on-one medical students in your office, you're in the hospital doing rounds, whatever it is. Those are your opportunities, I think, to kind of almost promote your teaching style, I would kind of say, in that you may have come up with a good way to, like, you know, have students in your office, how you manage it, and kind of getting that sort of packaged up as something that you have almost created like a little mini curriculum in a sense. You know, this is how I teach students in the office. You know, this is what I do on rounds, you know, and it's that kind of teaching, I think, that you can actually sometimes turn into either some sort of scholarly work, okay? And scholarly doesn't have to be original peer reviewed. You know, it can be chapters, it's non-peer reviewed work. It can be, I think, sometimes blogs, sometimes that you write patient education materials, you know, that go on websites. So I think that those are other things that are, you know, definitely attainable. Obviously, original research is great, but, you know, everyone may not have that access to that or the time for that. But there are other ways to kind of get those kind of scholarly publications that are needed for certain levels. So I think what you do on a daily basis, if you can somehow, I don't, like I say, package that up, you will have, you know, something substantive, I believe, to put on your CV. So just kind of,
Thank you.
this group is.
A busy group.
Can I say something, Shelley, about reputation too?
Sure.
Because that's sometimes
Another thing.
a very difficult thing that people struggle with. And when you think about, well, how do you establish, say, a regional reputation? If you were a member, say, of, in my department, the American Academy of Pediatrics, there is a Rhode Island chapter. The Rhode Island chapter is actually very anxious to have local pediatricians that are in clinical practice, that are in practice in the hospital, involved in helping to determine policies, in helping to plan educational material events for the practicing pediatricians in the community. So I often recommend that for people who are struggling with how do I develop a reputation that's regional. And then frequently, once you get involved in these things, it's easier to make more of a reputation for yourself when you need to move up to the professor level and you're on a clinician educator track and you need to have a national reputation. Frequently, you can use those local and regional involvement to then get involved at the more national level in the same organization that has that you've been working your way through. So that's often a challenge. And then oftentimes people say, well, how am I going to do this? And I think you really got to think about, well, what organizations do I belong to and where might I actually contribute to those organizations?
Thanks, Penny. That's a really good point. And I can tell everybody here, and I think since it's being recorded, I can be quoted that Rhode Island is officially a region. So
the other thing to tag on to that I was going to say is that if you are outreaching in other hospitals like Massachusetts or Connecticut, if you're like traveling to see patients, getting on those other committees at another, you know, out of state will be another way to kind of pave that regional reputation as well. It's just another thought.
exactly. So, and now I'd like to get to your questions and introduce Alex Kelleher, who is the Director of Biomed Faculty Administration. And Alex is going to help us navigate the questions.
Yes, so I've already been receiving a few questions in through the chat function. So please continue to send either questions through to everyone and I'll get them, or also send them directly through to me and I'll post those to the group. So just one logistical question to answer for everyone right at the start. While the presentation was happening, we received a question of where are the DEI metrics located? You all should have received those DEI metrics in the confirmation email for this meeting that you received from the CME office. So those were attached to that confirmation email. So everybody should have quick and easy access to them right from the start. So now the first question that we've had come in through the chat is, what is the % chance for promotion success once you're sent along to the committee and then along to CMFA?
I can answer that one
Yes.
So, you know what, there's so much vetting along the way that I am happy to report that once you are presented to CMFA, it's like, what, Matt, would you say 98% likelihood of promotion?
Yeah, maybe higher. Yeah.
Okay, so so it's very high. So that's why I say there's no harm in starting with your department, your division chief, because if you're not ready, they'll let you know, and you can come up when you are ready. And the good news is that after you put in all this work, you get rewarded with a promotion almost all of the time. So thanks, Alex.
Great.
That was the
The-
soft cost.
All right, the next question that has come in is a little bit about the timeline and time frame, about preparing your package, your dossier, and how to approach this within your department. There's some questions about, is this a rolling process? Is there a certain month or date that I need to have things submitted or prepared each year? So I think that this might be a good question for Deb or Penny, serving within your departmental promotions committees. How that works within your departments.
You want to start, Deb?
Sure. I can speak for Department of OBGYN. We have 3 meetings a year where we actually present what we call a first look at somebody's CV. And if that CV is already pretty well formatted and all those criteria are pretty well already met, then usually the committee would approve to move forward. And then the next steps would be obviously a personal statement. It would probably come back to our committee, reviewed by the personal statement would be reviewed by the committee, all the while the candidates updating their CV all the time. And this is the one situation where I tell people more is always better. Okay, not less, but more is always better in this situation. So I always encourage everyone to continue, increasing work on their CV. Once the personal statement, the CV is all wrapped up, then it will be a matter of getting names to send out and getting those letters back, which is always a chore, but we do accomplish that. We have that electronic form that I don't know if this group needs to know about or not, but it is possible that if somebody's ready to go, and this just happened in our department, everything was there and probably it's going to happen within 6 months. Okay. For somebody who's not quite ready, the CV needs a lot of revising and that, and people are not quite where they need to be. It could be about a year, possibly 1.5 years, as was already talked about, before you actually hit the ground. Because we have to anticipate those slots at CMFA. So you have to kind of, be ready for like a year ahead of who you think is going to be there to go.
Yeah, so the Department of Pediatrics is a little bit different. We meet monthly, except we usually don't meet in August, but we meet most of the rest of the year on a monthly basis. We do reviews of people that we think are ready or people who have requested review, and then we move them along based on their readiness. So there's no set schedule really. We do have to put together a list of people to submit for CMFA slots by June of every year. And so we actually are working on our 2023 slots right now, but it's a very rolling process. It's like rolling admissions. We identify people as we move along and put them on the list. And then if they're not ready this year, where they're already on the but we think they're a year away, they go on my list to be re-reviewed a year from now. So it's really a very much a rolling process and really is very dependent on the readiness of the particular candidate, not so much on what the strict scheduling by the committee.
I think that Deb and Penny's answers really highlight the fact that you should check in with your department administrator to be sure you understand your departmental timelines, because they do vary across departments.
It might also be because of the size of the department. I got a hunch too.
Yeah, definitely. I think medicine probably meets, and psychiatry probably meet monthly as well.
Yep.
All right, we're getting some great questions on the chat, so I want to jump right into the next one. Here's a bit of a more specific question, but I know it'll apply to different people's areas of expertise. But with areas like informatics rising, and that might not necessarily result in the standard framework of publications or in a traditional section of a CV, should we include things like capstone projects that were implemented and where we're serving as project leads?
I can address that a bit. I mean, we have looked very much toward non-traditional kinds of scholarship, especially for the clinical and clinician educator tracks. If somebody's worked with someone, a graduate student on a capstone project, that should be listed. And we encourage that people have sections in their CV where they list their mentees. And if they've published with their mentees, or their mentee is now a faculty member somewhere, that they do list that so that they can get credit for having helped that person's career along. So, and also I think the other thing that I've been thinking about is, turning what you do and what you have passion for into scholarship. Frequently that may be writing a blog, or it may be developing materials for a specialty family group, or things like that, that I encourage people to put on their CVs, especially people who are in the clinical tracks, because that's a lot of times the kinds of work that you're doing.
That's great. Thank you, Penny. All right. Let's see. I'm going to try and group a couple of our questions together that are related topically. This one would be about reviewers and how to be collecting up a referee list. How should these people be chosen? How do you recommend them being chosen by yourself, the applicant going up for promotion, versus suggesting for the department to use? Do they all need to be purely on a clinical track versus just, anywhere across, that medical academic spectrum? Someone's asking about the number that should come from within versus outside of Brown. So there's a lot, a lot that we can touch on there related to reviewers.
I don't know, Shelley, if you want to comment about the number of letters required.
I always have to ask Matt the number of letters.
So,
Yeah, so for both tracks, you would need 5 letters. 3 have to be department selected, 2 need to be candidate selected. I mean, that's the minimum. You could have 8, 10 letters, or if you get, if you can get that many letters, that's fantastic. I know a lot of people have trouble just getting the 5, but or at least take some time. For the whether they need to be with inside or outside of Brown, for the clinical track, for associates, they can all be within Brown, but they have to be from outside of your department. Yeah. For clinician educator, they can be from within, but one needs to be from outside of Brown. And it could be department or candidate selected. I have to review that. Yeah, that's the minimum number for me.
And I will just add that they can be from any track. It doesn't have to be a comparable track at another institution. Yeah, so anybody, it doesn't, and they have to have a faculty appointment or a government appointment that would be the equivalent of a faculty appointment, but any track will go.
The only other comment I would make is when people go to select, name or choose names for people to write their letters, that they don't contact that person, directly themselves, like, please write me a letter. I also kind of encourage people, if possible, to get more of a geographic spread. Not 5 people from Boston, so to speak, but if they can, it just, I think, even though they may be at arm's length in Boston, it just seems more arm's length if one is California, Midwest, something like that, if they can possibly do that. But I think somewhat of a geographic spread also gives a little bit more objectivity as well.
We also, when we're asking for letters, usually ask for 2 to 3 times the number of letters that we need from you. And again, you're not going to approach those people. We will. We want the evaluation to be anonymous. They need to feel comfortable if they don't have the time to say no. But we do encourage you to select if it's, we need 2 letters, we're going to ask you to submit maybe 6 names. Because we frequently find people are busy, people don't, can't do the letter, and then we can move on to the next person. And if we get too many letters, that's not a problem.
A good problem to have.
Mhm.
So Alex, I'm looking at the time and we're getting into our breakout session, but maybe you have one more question?
I can do one more kind of summary question that I've gotten some connected questions about through the chat. The timeline for promotion, do faculty members need to follow a specific timeline before they can go up for promotion? Can they go up early if they are heavily involved? If they're coming from outside of Brown and have spent time elsewhere as a faculty member, does that timeline count towards their time in rank? So all about the timeline for promotion.
Well, I can start if you want me to, and just say that there are no rules. So you should come up for promotion when you meet the criteria. Some departments may have some guidance about how long that should be. But in terms of the university, the medical school, we don't have any hard and fast rules. So come up when you're ready. And we do look at time in rank at other institutions. So I don't know if Penny and Deb look at it that way as well, but that we certainly do. So if you spent a lot of time at another institution, an assistant professor, then that counts for sure.
Right. Yeah, we have a little bit of because we have so many people to review, we try and review everyone when their appointment, about the time of their reappointment, which is 5 years, if they haven't come up for some reason before then. But our sort of aim is to review every person after they've finished their 5-year term, because the clinical ranks, they're all 5-year appointments, except for instructors, which are 3, if I remember correctly.
Excuse, I didn't know if the person was asking if this was an up or out type of situation. I don't, but it is not
No.
in these tracks. So I don't know if that was a question. So.
Yeah, and so, I mean, I think some people do, spend their entire time at Brown at the assistant professor rank. We don't encourage that. We'd love to see people get recognition for the work they do. So we like to see people come up to associate professor, because you can retire emeritus or emerita. Did I see a hand? Beth Raymond?
Yeah, thank you. I was just curious, in looking at the referee guidelines, if it can't be a collaborator or something, like, how do you find a referee if it can't be someone that you know?
Well, one of the things that we do, at least for the department letters, is to ask division chiefs and people who are familiar with your area to help us find writers or referees. That helps. But think about people you may have worked on a committee with, people that you may have spoken at a meeting with, people that you have talked to at a meeting, people that are in the same area have the same area of interest as you do, because they're really going to look at your CV and judge how they see you from your CV. It isn't, so people oftentimes, when we send them letters, send us back something saying, oh, I can't do this because I don't know this person. And we send them, I often will call them and talk to them and say, look, we don't need you to know the person. We want you to look at the materials that we're sending you, judge it as compared with your institution and what your understanding is of your criteria that you're, our criteria. How do you as a faculty member fit Brown criteria? And they look at the CV and they look at the criteria and they're trying to fit those 2 things together.
Thank you, very helpful.
I may have overstated the don't include collaborators. If you've published because you've been, a site for research and you've published with a lot of people, and, one of them happens to be someone you'd like to ask for, a reference, that's fine. I mean, but we don't want them to have done a lot of collaboration with you or have been your mentee or mentor.
I also tell people not to, any relative.
Yeah.
But
Thinking from the, oh, sorry, go ahead.
But, you know, if you were a resident with someone and then spent, you know, 5 years together, they're not probably going to be very objective. So what we're looking for is people that can look at you objectively. So if it's somebody that you know and you haven't spent your entire life working with, that's probably, for the clinical tracks, it is hard to find referees. So
Yeah.
usually try to be pretty liberal about who you can ask.
And when you think about referees within Brown, it may be people with whom you've shared patients.
Yeah.
So they can often be great referees for the clinical tracks.
I was just gonna say, it's gonna be someone you know, because we're asking you who you want to write a letter for you, but it won't be someone from your own department, okay? It can be like outside of the department, and it will probably be someone that you've worked with maybe once or twice, but it's not gonna be someone you've worked super close with. So it will be somebody you know. How else would you know them?
Although sometimes it could be somebody who is a visiting professor that
True.
you met with, but you don't really know them well. So.
Yep.
Great. So Alex, are we good, do you think? Or do you have a
Yes.
burning question?
No, I think we should move into our breakout rooms because some of these questions I think would also be great conversations to be had in our track specific breakout room. So I think we should just move along to the next step of the meeting.
Okay.
So we will be posting up on your screen, or we'll be opening up the breakout rooms for the clinical and clinician educator tracks. So when you open those up, we just ask that you please self-select into your track to head into that breakout room. If you aren't certain about which track you should be heading into, just stay in this main room here and we'll have a couple of BMFA staff stay behind so we can help get you sorted into the right room. So once we head into those breakout sessions, each of our breakout leaders, they will introduce themselves and just kind of get going with the next hour of the meeting.
And I want to thank our panelists. So thank you, Penny. Thank you, Deb. Thank you, Matt. Thank you, Alex, for coordinating the questions. And also thank our breakout session leaders. They are